Welcome to the Mama Civet YouTube channel. If you've been dealing with hip impingement, bladder urgency, or even right SI joint pain, in this workout, we're gonna move through a mobility flow and a strength routine to help offload that right anterior pelvic floor that could be causing a lot of these issues for you. Hey, my name is Gina. I'm a perinatal fitness trainer and mom of four. And right pelvic floor overactivity is something that I have personally dealt with during my pregnancies. I work on in the postpartum now, and something that I want to help you with. And so if you've been dealing with bladder urgency where you feel like you have to pee all the time, where you pee and you feel like you have to pee again, if you've been dealing with right hip impingement, so when you're doing like a squat or a lunge, you feel like kind of like a pinching in that right hip crease, or you've been dealing with like right SI joint pain, those can all be signs that that right anterior pelvic floor, so this right front quadrant here, is a little overactive. So in this workout, we're gonna do some exercises that help to release and offload this anterior portion of the pelvic floor, plus movements that help to strengthen the surrounding musculature so that we can do a better job of changing positions to change the tension within the pelvic floor. Before we dive into the workout, there's one concept that's really important to understand that you may be familiar with if you've watched our other videos, but if this is new for you, the pelvic floor is a sling of muscles that attach to the bottom of the pelvis. So they physically attach to the pelvic bones. And so when I change positions, when I step from foot to foot, the tension within the pelvic floor is going to change. So the pelvic floor tension is not uniform, it's not perfectly symmetrical. It's going to vary based on what leg you have more weight into, if one hip is more open or more closed. And so you can think about the pelvic floor have 4 different quadrants, and each of those quadrants tension is gonna change based on what leg you put more weight into. And for a lot of us, we tend to favor more weight in our right side. The organs are denser on this side, the diaphragm is larger on this side, so we like to favor more of an asymmetrical stance on the right side. This asymmetry is not bad. It's okay if we are a little bit more asymmetrical, but the problem is when we spend all of our time on the right side and we're not really spending enough time on the left as well. And there could be a number of reasons why you always like the right side. Maybe this side feels more comfortable for you. Maybe you don't feel as stable on the left side. And so we're gonna address that in this workout because we do want to spend more time on both legs because we don't want to have this really uneven overactivity within the pelvic floor. And so when we spend all of our time on our right side, that right anterior pelvic floor is going to get denser, it's going to get thicker, and it's going to be really overactive because it's pulling that right hip into a more internally rotated position or a more closed hip position. And so we're going to do exercises that bring us into the opposite position to help release it and then to strengthen it so that you feel more stable in that position as well. And so for this workout, we're going to need 1 yoga block in addition to 1 medium to heavy weight for you. And so once you've gathered that, I'm going to meet you down on the floor to begin our mobility flow. So we're gonna start this workout in a tabletop position. And so we're gonna do an all fours lateral hip shift. Feet or your knees are gonna be a little bit wider than hip distance. And I'm gonna start by thinking I'm bringing this right hip towards my left knee. So I want this kind of rotation in the pelvis to where these 2 points are getting closer together. So knees are a little bit wider than hip distance. I'm gonna think drive that right hip towards the left knee. So the angle here between my right femur and my pelvis is greater than 90 degrees. So this angle is greater than 90. If I wanna add a little bit more, I'm gonna bring the right toe towards that left foot for a little bit more external rotation on the right side. And then I can also think press into like that right inner knee to like help kind of drive me a little bit deeper. So I'm pressing into that right inner thigh, and this is gonna help drive me deeper. And I'm trying to feel like a stretch in my right groin. Then if I wanna add a little bit more, I can think arch in the back. When we have a more extended spine position, it's going to change the femur position and make this external rotation easier. The next way to advance it is to drop down to that forearm to find a little bit of a rotation towards the left, but really think driving that right hip towards that left knee. Now, if we want to target more of the inner thigh, we can find an adductor rock back. So I'm going to straighten that right leg, and then my hands are going to be in front of me, and you can just rock forward and backwards. And you're gonna feel more of a stretch in the inner thigh. So the lateral hip shift was more of a groin with that knee bent. With the leg straight, you're gonna feel it more kind of the entirety of that inner thigh. And then if you wanna add a little bit more, you can take that forearm and you can drop down to find a little bit of a twist and just moving forward and backwards, feeling more of that inner thigh stretch. And now we're only going to do these two exercises on the right side, depending on how much you've done our workouts where we do a lot of asymmetrical work. That may be mentally challenging for you, where you're like, well, what about my left side? Know that we are not perfectly symmetrical, so we don't always need to do the exact same thing on both sides. And if our goal here is to release that uneven tension, we're gonna target the right. Now, if you wanna pause the video and do the left side because that feels mentally better for you, that's fine. But we are only gonna do the right side. It doesn't hurt if you do the left side though, but if we're targeting the uneven tension, we wanna focus on the right. In addition to the mobility, we do want to do some strengthening as well. And so we're going to grab onto that yoga block and we're going to place the right knee onto that block. And so with the releases, this is releasing the uneven tension, so we have the opportunity to change positions, but now we have to actually change the position. And so we're gonna put weight into that right leg onto that yoga block, and so that left knee is gonna be down on the floor. And then I want you to imagine there's a foam roller between your thighs, and we're gonna roll that left knee straight up, and then bring it straight down. So we're doing these knee lifts where it's the right glute that is shortening to pull the hip up and then eccentrically lengthening to lower the left knee down. And so all of the effort is in that right glute. So we're exhale, drive straight up, and then inhale to lower down. And so the right posterior pelvic floor, or the glute area of the pelvic floor, is a little bit more lengthened than the right anterior. So right anterior is firing a lot to pull right hip into that more closed hip position because we stabilize and we stance more internally rotated. But when we extend the leg and we're in our non-stance leg, we're more externally rotated. And so this is helping to kind of pull that hip more external and then internal to lower down. Now we're going to find an inner thigh strengthening exercise on the left side now. So we're gonna come into this 90-90 position. You're gonna take that yoga block and place it underneath that left knee. And then we're gonna drive through that left knee to find more of a activation in that left inner thigh. So this is our adductor side plank. And so go ahead and drive through that inner thigh to lift the hips off the floor. And then you can add in some pulses on that right side. And so what we're focusing on here, because you might be like, wait, we're working on the right side, why am I doing an exercise on the left? Is the right posterior pelvic floor has more length to it, and so does the left anterior. So it's kind of like opposite sides tend to be more lengthened and more shortened. And so here we're focusing on strengthening that left anterior pelvic floor and musculature that helps to support the pelvic floor in that position so that you could feel more comfortable spending time on that left side so we don't have to spend all of our time on the right. And so we're going to be thinking about left inner thigh strengthening exercises, left hamstring exercises, movements that bring that hip more internal. And now let's come to a standing position and just have your weight nearby for the last exercises. So we're gonna start with a wider stance position. This is gonna be our more active mobility exercise. We want your stance to be wider than hip distance, and we're gonna find a lateral hip shift to the left in a standing position now. So similarly, I'm thinking right hip is gonna move towards my left knee. So I'm trying to bring those 2 points together. I can find a little bit of an extension in the spine. And now I don't want my left knee to flail out, and I don't want my feet to roll out to the side. So think lots of weight in both big toes. Left knee, right hip trying to move towards one another. So if I have my hands on my hips, my hands are not even. My right hand is lower than my left because I want that rotation to be happening. So we're gonna feel a stretch in that right groin, right inner thigh. It should be kind of a combination of the two floor-based exercises that we did. A little bit of extension, and then with the right hand, you can kind of reach for that left foot. After this, we're gonna move into alternating from side to side. So we're gonna find a hip shift to the right and then back over to the left. For that variation, if you wanna add a weight to move a little deeper, you can. So let's go ahead and begin to shift from side to side. So now I'm gonna bring my weight over to the right and then back to the left. And again, if you wanna add a weight, feel free. If you just wanna do a body weight, because it's a new movement for you, that's also fine. But we want the rotation in the upper body. So we're a little bit of a twist, a little bit of a twist. Trying to think right hip, left knee trying to touch, left hip, right knee trying to touch. Lots of weight in both big toes. Let's go ahead and place that weight down. And now we're gonna come to our standing variation of that knee lift. So I'm gonna put weight into my right foot, and I'm gonna have my right hand just be by the wall. And it's gonna be a very similar, where I'm thinking, drive that left knee down, and then I'm gonna pull that left knee straight up. So it's kind of this up and down type motion that's gonna be happening. So I'm gonna put my weight or hand into that wall, drive that left knee down, and then drive it straight up. And I'm gonna be moving up and down with this. Now the second part of it is as I drive up, I'm gonna think open in that left hip, come back down, and then drive it straight down. So I have my hip shift to find that eccentric lengthening in that right glute. I'm gonna pull that right glute to lift that left knee up. I'm gonna open in the hip, bring the knees together. So we kind of got this like combo move happening. We're gonna do this on the right side as well. So we find our hip shift, drive up, open hip, back. And then eventually you can add weight to this. So as you lift up, you have like a weight or a bumper plate on that leg to make it a little bit more challenging. Now let's switch to the other side. So weight's in that left foot. I'm gonna think drive, right knee straight down, drive, right knee straight back, and then open in the hip. Bring the legs together, drive, right knee down, drive it up, and then open. And so we've got these three kind of distinct steps happening. I find my closed hip position, which is my internal pelvic rotation, open hip position, external pelvic rotation, and then open hip, which is my external hip rotation. So pelvic rotation is how does my pelvis move on my femur. It is going to be typically more with your closed hip position or your closed chain position. So my foot is on the floor, so my left pelvis is what's rotating. And then hip rotation is How is my leg rotating on my pelvis, which is this lifted leg? Now we're gonna move into our more strengthening exercises with our weight. And so I'm going to hold the weight in my right hand for both the right and the left side. So we'll start with that right side. Right foot's gonna step forward and left foot is going to step back just a tad. And I'm holding the weight in my right hand. So same side, your ipsilateral hold. And then inhales to lower down, exhales to stand up. So you may find that when you have an opposite hold, that it feels much more pinchy because you're finding a little bit more of a twist as you lower. And if that anterior pelvic floor is really overactive, you're gonna feel a lot of kind of pinching in there because there's just a lot of muscle that's kind of like taking up that space. And so one strategy that you can use to do your single leg exercises on the right is to hold the weight in the same side because it's gonna prompt you to find a little bit more of an open hip position. So it's gonna help to give you just like a little bit more space to do this movement. Now keep the weight in the right hand and we're gonna switch to the left foot. So inhales to lower down, exhales to stand up. And so now we have that opposite hold, more of a contralateral position, which is helping to pull the left hip more internally rotated. So the same side hold emphasizes more external rotation or more of an open hip. Opposite hold tends to emphasize more internal rotation or a closed hip. And so depending on the goal that we have for each leg, we may want to hold the weight on a certain side. So for me on the right side, I'm trying to emphasize more of an open hip position because that leg is commonly stuck internally rotated. While on the left side, I'm trying to focus more on a closed hip position because this leg is typically stuck more externally rotated. Now, if we want to add a little bit more, I want even more strengthening going on, and I want to maintain more of that upright position. We can do it with our Bulgarian split squats. And so this is kind of like the in-between the stagger stance and like a single leg squat, but you can typically load more weight. And so similarly, I'm going to have the weight in the right hand. So right foot's on the floor, left foot is gonna be on the bench behind you. I'm gonna inhale to lower down, exhale, come on up. So same side is gonna let me have more of that open hip position. Think about keeping weight in that right big toe as you lower. And these more upright positions, so like our lunges, our squats, are gonna target more of the quad. When we find more of a hinge position, it's gonna target more of the hamstring. And so for the right side, emphasizing a little bit more of like the quad and glute can really help with pelvic floor balance as well. And if you're feeling any pinching, just really find a little bit more open as you lower, and then exhale, come up. Let's go ahead and switch feet. So weight is still in that right hand. So now we have a little bit more internal rotation as you lower down, or more of a closed hip position. So I'm still doing the same movement on both sides. I'm doing the Bulgarian split squat on both sides. However, I'm holding the weight differently, or I guess I'm holding the weight the same on both sides, but it's kind of producing a different response in my body. So it looks the same, but there's a minor tweak that's making it a little bit better for my body's imbalances that it normally has. And it's very likely that you have similar imbalances, which are not bad. But it's good to be aware of because then we can enhance our workouts to make them a little bit better. And so that concludes our workout that's targeting the right anterior pelvic floor. We started with movements that help to release and offload that musculature. And then we moved into some exercises that help strengthen the opposing sides so that we can pull the pelvis into different positions. So we need to be thinking about releasing the overactivity, which is typically that right anterior portion of our pelvic floor, and then strengthening the underactivity so we can pull that pelvis into different positions to offload the overactivity. And so I hope this workout was helpful for you to better understand what you can do to balance the pelvic floor so that it can work better for you and you don't have to deal with symptoms like bladder urgency, hip impingement, or right SI joint pain. If you want more workouts to help support your pelvic floor, knowing that it's much more than just squeeze it really tight, stretch the whole thing, because you now understand that there are different quadrants to the pelvic floor that all need slightly different things. Check out our online pre- and postnatal fitness programs. And if you feel like you're outside of both those windows, we do have our Beyond Postpartum Fitness program that I personally do in program, and I kind of write it for myself, where we are thinking about balancing the pelvic floor with all of the different exercises that we do. And you can check out our programs on our website at mamastayfit.com/fitness-programs and use code YouTube10 to get 10% off any of our online offerings. We offer our programs as on-demand, whereas a video like this where you follow along and work out at the same time. In addition to self-paced workouts, which is what our prenatal, postpartum, and beyond program all have options for. And so you can check them out on our website, and I hope to continue to support you to feel good in your body during your journey.